When I was 17 years old, my doctor ran a blood test because I was having so much joint pain. He said I had high uric acid levels, so diagnosed me with gout and said I had to take a medication for it. So I said, well, how long do I have to take this for? And he's like, well, the rest of your life. The rest of my life, I'm 17 years old. Well, your father has gout, it's genetic, so you're just gonna have to live with it. That just didn't sit well with me, but I was going off to college, so I didn't have time to deal with it then. So I remember getting into my dorm room, opening up the box of medication, allopurinol, and reading the package insert. So I opened this thing up, it was pretty long, and read things like the side effects, rashes. I was like, rashes, I already have rosacea, other skin issues. That's not good. Joint pain, so isn't that why I'm taking it? Kidney damage, liver damage. I was like, oh my gosh, there's no way I'm taking this. So I called up my doctor, who happened to be my father, and I was like, Dad, like, how do you expect me to take this? He's like, oh, don't worry about that. If everyone read the package insert, then no one would take any medication. I just, it didn't seem right to me. There had to be another way. So I started, went to the library. There was no internet at that time, started doing research and found out that with changing my diet, that I could lower my uric acid and get this cleared up. So that's what I did. I changed my diet and my uric acid went down. Here we are years later, my uric acid has been fine since. What I wanted to talk to you about today is how to lower uric acid with diet, as well as the interaction between that, ferritin levels, insulin resistance. So my name is Dr. Tom Rofrano from the Natural Medicine Clinic in Palm Beach Gardens, Florida, and author of the FreeDiet. And I've had the opportunity to see over 100,000 patient visits over the last 38 years, many of whom have gut and thyroid issues, and ferritin abnormalities is the common thing I see, and that ties in with insulin resistance, which uric acid is also related to insulin resistance. People associated with high uric acid with gout, which is a type of arthritis where uric acid crystals form in the joint, causing pain and inflammation. It also, though, uric acid is associated with insulin resistance, high blood pressure, cardiovascular disease, inflammation, and how that relates to ferritin. Well, ferritin is also related to insulin resistance. That's the most common cause of high ferritin. And iron overload is related to high uric acid. And then you have inflammation can cause high ferritin, and inflammation. High uric acid is a sign of inflammation as well. So they are related, and I often see both of those elevated along with insulin. So I'll tell you about a patient I had who had all of this. Well, he came in with back pain, fatigue, insomnia, dizziness, high blood pressure, high uric acid, prostate issues. And when I ran initial testing, yes, he had high uric acid. And normal levels, it varies depending on the lab, but it's between 3 and 7. And if someone has gout, you want it less than 6, but really the optimal range is less than 5.5. So he had a level of 7.4. He had above optimal insulin levels, GGT, which is a liver enzyme. He had above optimal ferritin levels as well. And he had high blood pressure and he was overweight. So I put him on an anti-inflammatory diet. I call it FreeDiet, and some supplements, which I'll go over in a few minutes. And a month later, he came in, and not only was he feeling better, lower back and shoulder pain, his insomnia, his abdominal pain, he had more strength, improved mobility, improved vitality. So he just felt great. And that was in a month's time, but he dropped 15 pounds in 4 weeks. His blood pressure dropped 26 points to 119 over 73. His uric acid went down from 7.4 to 6.3. So that dropped over a point. He also reduced to optimal levels his cholesterol, insulin, GGT, liver enzyme, and his inflammation marker CRP went down 65%. That was in 1 month. At the 3-month point, his ferritin was down 23%. So that went down substantially. His PSA was down 20% to less than 2. And his testosterone, this went up. So it wasn't bad. It was 640 initially, but that went up to 916. So it went up almost 300 points in 3 months without taking testosterone. And at that point, he also dropped 22 pounds down to 194, reaching his goal weight. That's the thing, like if someone has high uric acid, you could just take a medication, or you could say, all right, well, there's something going on here. Like, why is uric acid high? Okay, let's see. That's going on. You put that together with the insulin resistance, high ferritin, blood pressure, overweight. Instead of just taking a medication to lower uric acid, let's clean up your diet, get these things balanced out to optimize your health. And then you can use these signals, use the like uric acid, ferritin, insulin, to then get you to change your lifestyle and then just transform your health completely. Or you could just keep eating and drinking and keeping the same lifestyle and take the drug for whatever you want. So it's really a choice. The steps to doing that, let me go over that. So the first step is you want to get proper testing. When you go to your doctor, they typically will run a CBC, metabolic panel, lipids, TSH. You want to make sure you ask for, besides that, ferritin, iron saturation, TIBC. That's an iron, ferritin and iron panel. CRP, LDH, GGT, that's for inflammation, liver enzymes. And then insulin, A1C, uric acid, very important. They don't check this unless you ask. And then other thyroid, free T4, free T3. So this would be the minimum. I like to also check autoimmune markers, ANA, thyroid antibodies, reverse T3, hormones, adrenal hormones, sex hormones, certain nutrients, urinalysis. So as far as getting this test, and if your doctor won't run it, you can get another doctor. You can order these on your own. In many areas, the challenge with that is then you need someone to interpret it for you. So in any case, this would be the minimum, plus these if you can. And then what I like to do beyond that, identify root causes, is functional testing, which includes deficiencies, toxins, infections, hormonal imbalance, and then food reactions, including testing for gluten sensitivity and leaky gut. For this patient, those tests revealed he had high levels of mercury and arsenic, an overgrowth of bacteria and yeast in his gut, as well as a parasite. He had various food reactions, including gluten sensitivity and leaky gut, and specific nutrient deficiencies, and some adrenal dysfunction. Step 1 is testing. Step 2 is the diet. And the diet I call it a free diet. It's a diet I came up with years ago when I was figuring out how to heal from my chronic health issues, including Hashimoto's, autoimmune thyroid, rheumatoid arthritis, IBS, fatigue, skin issues. So I was able to get better, and I call it the free diet because it's free of not only gluten, but gluten grains, sugar, yeast, dairy, eggs, soy, legumes, nightshades, processed foods, all those foods most commonly responsible for gut, thyroid, and other chronic health issues. If you'd like a copy of the free diet phase 1 food chart, I'd be happy to send that to you, put a link below. And also we'll put a video at the end of this that goes into more detail. To summarize the diet, though, lunch and dinner is very simple: meat, chicken, fish, plenty of vegetables, healthy fats. For breakfast, it's a smoothie that's high in protein, essential fats, fiber, and vegetables, some fruit. And the reason why it works for uric acid and ferritin and insulin for that matter, and blood sugar. So the main driver is sugar, in particular fructose, excess carbs, yeast, alcohol, and processed foods. So we're eliminating that. Processed foods is not only high in high fructose corn syrup typically and other additives, but seed oils, including canola, soy, corn oil. So it's free of that. And those are the main things you need to avoid when you want to lower uric acid, as well as insulin, triglycerides, Ferritin. So that's how that works. And as far as supplements go, we have the functional 5, which are those foundational 5 that I found almost everyone needs. That's multi-fish oil, vitamin D with K, magnesium, probiotic. And then for him, I did specific gut support nutrients, liver support, and certain nutrients he was deficient in, methylfolate, zinc, selenium. He also did metal cleanse because to help support his excess mercury and arsenic levels. So that's how after a month's time he was able to make all those improvements, and not only clearing up his fatigue, insomnia, shoulder and back pain, abdominal pain and bloating, but normalizing his weight, dropping his blood pressure, improving all those values, uric acid, insulin, inflammation, all those factors we mentioned, dropping his blood pressure almost 30 points, achieving his ideal weight. So it's by really, number one, getting the proper testing to determine the root causes and then being provided the right solutions. And if you do that, I believe almost anyone can get better and improve your overall health and vitality. So thanks for joining me today. I'll put a link to the FreeDiet Phase 1 food chart below. Feel free to like and subscribe, and I look forward to seeing you next time.